Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament. I'm 28 years old. We fear that we may not survive this pandemic, and yet we show up every day to this hospital to take care of our community.
Just finished an emergent craniotomy for subdural hematoma to remove a blood clot that was pushing the brain of a patient. Before surgery, I was fitted for an N95 mask. We tried 2 or 3 different ones, but we didn't think any of them were 100% properly fitting. But I couldn't waste too much time, so I had to go with one that I thought was fitting the best, and went ahead and did the surgery. But throughout surgery, once in a while, I was thinking if I was breathing any virus particles in the operating room. I don't think so, but not unusual to experience the kind of anxiety, which makes me realize all the nurses, doctors in the emergency rooms and ICUs and COVID-19 wards risking their lives to take care of these patients. All the stress and anxiety that they must be experiencing every day, and they do that every day. And same thing with the first responders. So here I am saying, my hat's off to them, and I salute them for doing this every day, going through this unbelievable anxiety and stress of potentially exposing themselves to this deadly virus. Again, my hat's off to them and salute them.
We are demanding that we get all the hoarded supplies that exist of PPE so that we can protect ourselves, our families, and our beloved patients and communities. We can't do it if we're dead.
This is a man-made problem, and we need a man-made solution. We are told that they are searching for more PPE. Today, I stand with the nurses to call upon Donald Trump, upon our local and our hospital leadership to stop looking for PPE that doesn't exist and start producing it. We are past the point of last resort.
I hope the president and all the politicians and all the health insurance and pharmaceutical industry CEOs and device manufacturers and the administrators of the hospitals experience what it feels like to go through taking care of these patients.
Dr. Ming Lin is an ER doctor who worked for a hospital outside of Seattle through a contractor. He says he was fired after sharing his concerns about healthcare workers' safety on Facebook.
A lot of us are intimidated from talking. A lot of us, choose to remain anonymous is because our voice is suppressed.
It is a 10-second video of RN Kanisa Barkai. 12 days ago, she shared the video on her Facebook page showing how she geared up to treat the very first COVID-19 patient inside Sinai Grace Hospital in Detroit. This past Friday, the DMC fired Barkai for violating the DMC's social media policy, and now she is no longer fighting on those front lines.
I don't feel like I violated the social media policy per se, especially at a time like this when everybody around the world is voicing their concern, their opinions, facts.
Barkai also spoke out to Local 4 on March 18th, sounding the alarm that that she could see how the hospital needed more staffing, that she knew more sick people would flood the facility. She says she felt it was her duty to speak up. Even after being fired, Barkay says she will continue to be a voice for nurses risking their lives on the front line.
I'm Nurse Strong. I stand here and I speak for a lot of my nurses, and I know that they're behind me. Maybe they can't speak up, but I know that they're behind me and they stand behind me 100%.